Hi, everyone. Tim Ria here with the Digital Health Summit in San Francisco. We have our first guest for the day, Mr. Joe Flowers, a futurist. Hey, Joe.
Hi there. How you doing?
So good. So we're getting ramped up here. And Kirst, what is a futurist, so people understand what your background is?
I speak and write about the future of healthcare, and I've been doing this for a long time in the past. My first articles about digital health were in 1985. My first articles about population health were in 1990, and I was an investor in companies in the dot-com boom of the 1990s. We've been down this path a long time. Now, all of a sudden, because of the changes in the economics of healthcare, all of a sudden, population health management and digital health, those are like the buzzwords of the day. But that's real. And it is a tremendous opportunity. That's what we've been talking about here.
So yesterday we had sessions for startups, entrepreneurs, trying to understand the landscape. And you have some pretty interesting points on the landscape and the economics of health.
Yeah, there's this huge opportunity in digital healthcare, but there's also a huge possibility of getting it wrong, getting the market wrong, because of people like you and me, because the people who are designing these things, the people who are running them, they're mostly, well, a lot of them are mostly a lot younger than me, which is an important point, but they're also smart. They are well educated. They are likely to take charge of their own health care. And that is absolutely not the market for this. That's not the mass market. We're a rounding error in the mass market. We're like the 0.1% on many different scales. So what we need to, if you want to find that market, what you need to do is think about these organizations, these multi-specialty physician organizations, these big hospital systems, these large healthcare organizations that are out there trying to figure out how to actually do population health management. Because for the first time, we're getting paid not necessarily on the volume of things we can do, we're getting paid on how can we manage the health of these populations. There's lots of different business models to do that, but that is the rough package it's in. And most people running healthcare now really don't have any experience in doing this. They really don't know exactly how this is going to work. So it's prototypes all the way down. So the market is for, apps, dongles, gadgets, platforms. The market is, how do you help them do that? How do you help them bring the costs down of building a trusted relationship on a mass customized scale with their thousands to millions of patients out there? If you can come out with things that help them do that, bring the cost down, trusted relationship, constant contact, you have a huge market out there because they're hungry for ways to do this. And they really don't know how to do it.
So if you could be in any country in the world, where would you begin? And where's the brightest spots for digital health worldwide right now that you see?
Well, the brightest spot actually is right here, right in the U.S. And right, we're sitting in San Francisco, which is kind of ground zero of this whole tremendous change. And the reason is that the U.S. healthcare system is in a period of turmoil. It's in a period when most of the people who actually run healthcare systems are not really that certain what their business model is going to be, how they're going to survive, even within the next 3 to 5 years. It's an existentially threatening time for, partly because of the ACA, the Accountable Care Act, but also because of what's being pushed by employers and health plans out there, really different ways of paying for healthcare. So they're at sea, much more so than people in Canada or France or Australia.
Okay. So, Joe, we could go deep on this, but I'm sure a lot of people want to know how to reach you and what's up next for you.
What's up next for me? Well, how to reach me? My website is imaginewhatif.com. And what's up next for me? I'm writing a book now that we're going to bring out with the healthcare blog, thcb.com, in September. It is a how-to book. It's called A Handbook for the Revolutionary, Changing Healthcare Overnight.
All right. That's Joe Flowers. Thanks a lot for being on the show and being our first guest today.
Yeah, it's great. Thanks.